Ever feel like your body's got its own internal snack timer no matter how full you are? Or maybe you're wrestling with blood sugar numbers that just won't budge no matter what you try. Well, today we're taking a deep dive into a medication that's truly reshaping the conversation for so many people. It's called Tirzepatide, and it's the powerful active ingredient behind two names you might have heard buzzing around: Mounjaro and Zepbound. Now, before we unpack this complex topic, a quick but absolutely crucial note. What you're about to hear is for educational purposes only. This isn't medical advice. This deep dive is intended for adults, and it's so important to remember that your own clinician knows your health best seriously. They are the indispensable ones to talk to about your specific situation, your unique health history, and what's right for you. Okay. Let's unpack this. At its core, Tirzepatide is a fascinating molecule. Think of it as the master key, the active ingredient that does the heavy lifting. It's what we call a dual GIP-GLP-1 medicine, and the truly cool part. For all its complexity, it's taken just once a week. Now, diving a little deeper into that dual GIP-GLP-1 designation, because this is where the magic really starts to unfold. GIP stands for glucose-dependent insulinotropic polypeptide, and GLP-1 is glucagon-like peptide 1. These aren't artificial compounds. They're actually two natural incretin hormones your body produces, primarily in your gut, especially after you eat. Tirzepatide effectively acts like both of these natural hormones, amplifying their signals in your body. It's almost like having two incredibly efficient coaches working in perfect synergy to optimize your body's metabolic systems.
What's truly fascinating here is precisely that dual action. For years, we've understood the power of GLP-1 agonists, but the addition of GIP, well, that's what makes Tirzepatide a significant leap forward. To give you a bit more context, when you think about GIP, its primary role is to help your pancreas release insulin after you consume food, particularly in response to rising blood glucose levels. Then you have GLP-1, which also robustly boosts insulin release again in a glucose-dependent manner, which is key for safety. Helps prevent blood sugar from dropping too low. But GLP-1 also does something else incredibly important. It slows down how quickly food moves from your stomach into your intestines. And it works in the brain to help quiet those persistent hunger signals. So Tirzepatide hitting both GIP and GLP-1 receptors simultaneously means it's working on multiple complementary fronts. It's influencing insulin secretion, glucagon suppression, and gastric emptying, leading to a much more comprehensive and potent effect on both blood sugar regulation and appetite management. And the once-a-week dosing, like you said, it's a game changer for convenience and adherence, fitting far more easily into a busy modern life than daily injections ever could.
So these two names we hear constantly, Mounjaro and Zepbound, they are indeed part of the same Tirzepatide family. They share that same powerful active ingredient. But here's the real talk, and it's non-negotiable. You never, ever use both brands together. It's absolutely one or the other, prescribed for very distinct and specific reasons. You can think of it like different models of the same high-performance car brand. They both house the same advanced engine, that's your Tirzepatide, but they're engineered and approved for different primary purposes. You wouldn't drive two cars at once, right?
Exactly. The distinction is absolutely critical from a regulatory and clinical standpoint. Mounjaro, for instance, is specifically approved by the FDA for blood sugar control in adults with type 2 diabetes. Its primary clinical trial program focused on its efficacy in improving glycemic control, measured by things like A1C reduction, for individuals living with this chronic metabolic condition. This is crucial because effective blood sugar management is foundational for preventing or delaying many of the long-term debilitating complications associated with type 2 diabetes, things like kidney disease, nerve damage, or cardiovascular issues. Zepbound, on the other hand, received its approval for chronic weight management in adults who meet specific clinical criteria. This generally means individuals with a body mass index, or BMI, classified as obesity, that's typically a BMI of 30 or higher, or those who are overweight with a BMI of 27 or higher, but also have at least one weight-related health condition.
Like sleep apnea.
Exactly, like obstructive sleep apnea or high blood pressure, dyslipidemia, certain cardiovascular diseases. So while the underlying mechanism is similar, their specific indications and the patient populations they target are clearly defined and backed by distinct clinical trial data. It's about optimizing health outcomes linked to either glucose regulation or weight-related conditions.
So what does this all mean for you, the individual listener? Your clinician, your doctor, or prescriber is the one and only person who determines eligibility. This is absolutely not a DIY decision you can make on your own. They're going to meticulously review your entire medical history, your current health status, often a battery of blood tests, and really assess if either Mounjaro or Zepbound is the right, safest, and most effective fit for your specific health needs and goals. They'll consider everything from your other medications to your personal health targets, making sure it's a truly tailored approach. You definitely don't just walk into a clinic and say, give me the Tirzepatide.
This raises an important question, actually. While these medicines are incredibly powerful and life-changing for many, they're absolutely not for everyone. Specifically, they are not for individuals with type 1 diabetes. In type 1 diabetes, the body's immune system attacks and destroys the insulin-producing cells in the pancreas, meaning there's little to no endogenous insulin to work with. Tirzepatide, by enhancing insulin release, relies on existing pancreatic function, so its mechanism simply isn't effective for type 1.
Okay, makes sense.
Similarly, it's contraindicated in cases of diabetic ketoacidosis, or DKA. DKA is a severe, life-threatening diabetic complication where the body, starved of glucose for energy due to extreme insulin deficiency, starts breaking down fat rapidly. This process produces acidic byproducts called ketones, which accumulate to dangerous levels in the blood, leading to a dangerously acidic state. This requires immediate emergency medical intervention, typically with intravenous insulin. And Tirzepatide is entirely unsuited for managing such an acute and critical emergency.
Wait, scratch that. It's also a hard no, a complete contraindication if you have a personal or even a family history of something called medullary thyroid carcinoma, or MTC. And it's also a hard no if you have a genetic condition called multiple endocrine neoplasia syndrome type 2, or MEN2. Let's be clear on why. MTC is a rare but serious type of thyroid cancer, and studies have shown that GLP-1 receptor agonists, which Tirzepatide incorporates, have been observed to cause an increase in thyroid C-cell tumors in rodents during preclinical testing. Now, while it's not definitively known if Tirzepatide causes MTC in humans, this potential risk is serious enough that if you or a close family member has ever had MTC, or if you have MEN2, which is a genetic predisposition to developing MTC, then Tirzepatide is absolutely contraindicated. It's a case of prioritizing safety above all else, always.
And another critical exclusion is if you have severe gastroparesis. That's a condition where your stomach empties its contents too slowly. Given that a key mechanism of Tirzepatide's action is to further slow gastric emptying, adding it to an already severely delayed stomach could significantly exacerbate symptoms. Imagine dealing with increased nausea, persistent vomiting, severe bloating, and general stomach discomfort. It can make an already challenging condition much, much worse, leading to considerable distress and potentially nutritional deficiencies if food isn't moving through your system properly. So it's about avoiding compounding an existing problem and ensuring patient comfort and safety.
Beyond those very clear-cut no's, there are also some specific health conditions where your doctor will want to keep a really close eye on things. These aren't absolute contraindications, but they definitely require careful consideration, thorough discussion, and ongoing monitoring if you do start the medication. Think of it as a crucial checklist of things you absolutely must discuss with your clinician.
Precisely. For instance, if you have a history of pancreatitis, that's an inflammation of the pancreas or gallbladder disease, your clinician will weigh that very carefully. There have been reports of these issues with this class of medication, so if you've had them before, your doctor will need to monitor you closely for any recurrence.
Okay.
Similarly, existing kidney issues warrant a close look. Kidney function is paramount for processing and eliminating medications from your body, so your doctor will assess your kidney health thoroughly to ensure the medication can be safely managed by your system. And if you have certain diabetic eye conditions, like diabetic retinopathy, your vision might need closer monitoring, as rapid improvements in blood sugar control can sometimes temporarily worsen this condition. It's usually a transient effect, but it needs to be watched. They'll also have a crucial conversation with you about pregnancy planning. Generally, it's recommended that you stop this medication well before you try to conceive, often several months in advance. This is because there isn't sufficient data on Tirzepatide's effects during human pregnancy, and out of an abundance of caution, healthcare providers want to ensure the medication is completely cleared from your system before pregnancy. This also extends to discussions around breastfeeding and its compatibility.
Okay, so we've talked about what it is and who it's for and who should avoid it. Now let's get into the real nuts and bolts. How does this remarkable medication actually do what it does inside your body? In one breath, or maybe a few? How does Tirzepatide work its wonders? What's the fundamental science at play here that leads to those reported benefits?
If we connect this to the bigger picture, Tirzepatide primarily performs a few key interconnected functions within the body. First, and this is critical for blood sugar control, it helps your body release more insulin, but only when your blood sugar is high. This is the glucose-dependent part we touched on earlier, and it's a huge safety feature. It means your pancreas only secretes insulin in response to elevated glucose, significantly reducing the risk of your blood sugar dropping too low, which can be a concern with some older diabetes medications.
Okay.
Second, it actively turns down glucagon. Glucagon is a hormone, also produced by the pancreas, that essentially does the opposite of insulin and signals your liver to release stored glucose, particularly between meals, or if your blood sugar is trending low. By reducing glucagon, tirzepatide helps lower the overall glucose production from the liver, further contributing to tighter blood sugar control throughout the day. So it's working on both sides of the glucose equation, enhancing the hormone that lowers blood sugar and suppressing the one that raises it.
And here's where it gets really interesting for many people, especially those focusing on weight management. It distinctly slows down your stomach emptying a bit. Imagine your stomach as a precisely timed hourglass. Normally, food flows through it at a certain rate. With tirzepatide, it's like someone subtly adjusted that hourglass to flow just a little bit slower. This isn't a drastic, uncomfortable slowdown, but it's enough that the signals from your gut telling your brain you're full come sooner and last significantly longer. What that means in practical terms is that you feel satisfied and full on less food than you might have before, and that feeling of satiety persists, making you less likely to feel hungry again shortly after eating. It gives your body more time to process nutrients, signal fullness effectively, and ultimately reduces your overall food intake without feeling deprived in the same way.
That leads directly to what many people describe as the profound quieting of food noise. It's like that persistent background hum of snack thoughts, that almost constant mental chatter about what to eat next or how to resist eating, just gets turned down like a podcast volume knob. Your cravings. For many, they often get ghosted altogether. This isn't just a minor benefit. For individuals who spent years battling constant hunger cues and intrusive thoughts about food, this can be incredibly liberating. It frees up significant mental bandwidth that was previously consumed by food-related anxieties or decisions. It shifts the entire relationship with eating from a struggle of sheer willpower to a more intuitive, peaceful experience. It's not about being deprived. It's about a physiological shift that dampens the intensity and frequency of those hunger and craving signals, making it genuinely easier to make healthier food choices and manage portion sizes without feeling like you're in a perpetual battle with your own body. It can be a truly transformative shift.
It's so important to remember that the underlying mechanism is the same across both Mounjaro and Zepbound, despite them being indicated for different primary conditions. So the way tirzepatide acts on those GIP and GLP-1 receptors, how it affects your stomach, and how it impacts your brain's hunger signals, that fundamental physiological action is consistent. What differs is the clinician's assessment of your specific health condition, whether it's type 2 diabetes requiring glucose control or chronic weight management, addressing related health concerns that determines which brand is the appropriate prescription for you. And, real talk, it's crucial to understand that results really do vary from person to person. Just like with any medication, individual responses can differ quite a bit based on genetics, your specific health history, adherence to the treatment plan, and other coexisting health conditions. What works for one person might have a slightly different effect or timeline for another, which is why close and continuous monitoring with your clinician is so absolutely vital. They're there to help you navigate your unique journey.
That's right. Very individual.
So once you and your clinician have decided this medication is right for you, how do you actually take it? It's a weekly thing, which, as we mentioned, is super convenient. But it's not a one-size-fits-all dose from day one. Typically, you start low, often around 2.5 milligrams once weekly, and that's usually for about 4 weeks. This isn't the dose you'll necessarily stay on forever. Think of it as a gentle onboarding period, allowing your body to gradually adjust to the medication. It's like dipping your toe in the water before you jump in, helping to minimize those initial side effects we'll discuss shortly.
That start low, go slow approach is absolutely key, not just for comfort, but also for maximizing the likelihood of successful treatment. For Mounjaro, your clinician will typically guide you through a step-up process, increasing your dose in 2.5 milligram increments every 4 weeks. So you might go from 2.5 milligrams to 5 milligrams, then 7.5 milligrams, 10 milligrams, 12.5 milligrams, and potentially all the way up to 15 milligrams. Your prescriber sets your goal dose, and this isn't arbitrary. This careful titration schedule is thoughtfully designed to find the lowest effective dose for you while proactively managing any potential gastrointestinal side effects. It's a slow, methodical climb up that dosage ladder, ensuring your body has ample time to adapt to each step. The goal dose isn't a fixed number. It's highly individualized to help you achieve your specific treatment targets for blood sugar control or weight management.
The emphasis is always on finding your optimal balance between efficacy and tolerability.
Zepbound follows a very similar step-up approach, almost identical to Mounjaro in its titration. Many people find their eventual maintenance dose settles in at 5, 10, or 15 milligram weekly. But, and this is really important, your doctor truly controls this entire titration process. They are the expert guides leading you up the dosage ladder, making those informed decisions based on how you're feeling, how your body is responding to the medication, and whether your individual treatment goals are being met. They're looking at your blood work, closely monitoring your side effect profile, and assessing your overall progress. You won't just wake up one morning and decide, I think I'll try the next dose today. This is a collaborative journey with your healthcare provider, ensuring every step is safe and appropriate for your health.
Absolutely. Collaboration is key.
So what if life happens and you realize you forgot a dose? It's a common worry. We've all been there, right? You have your routine and then suddenly something throws you off and you realize you missed your weekly injection day. It's easy to panic a little in that moment, wondering if you've ruined everything.
The rule for both Mounjaro and Zepbound is actually pretty clear and quite forgiving. If you remember within 4 days, and that's a generous 96 hours of your usual injection day, you can absolutely go ahead and take that missed dose. So, for example, if your usual injection day is Monday and you suddenly remember sometime before Friday morning, you're still within that window and you should take it. The medication is still effective within that time frame and it helps you stay on schedule.
Okay, 4 days. That's good to know.
However, if more than 4 days have passed since your usual injection day, at that point, the recommendation is simply to skip that missed dose entirely. There's no clinical benefit to taking a very delayed dose, and attempting to do so can throw off your future schedule or potentially lead to increased side effects. Instead, just take your next dose on your usual scheduled day.
And here's a big one, a crucial rule to engrave in your mind. Never, ever double up. Seriously. Don't try to play catch up by taking 2 doses at once or taking 2 doses too close together. That is a guaranteed recipe for increasing side effects without providing any additional therapeutic benefit. It's like trying to make up for skipping a week of workouts by doing 2 days worth in one go. It just doesn't work that way, and you're more likely to hurt yourself than help. Consistency, not overcompensation, is the key here.
Precisely. And if for some reason you're looking to change your usual injection day permanently, perhaps because a new routine works better, you need to ensure you keep at least 72 hours or 3 full days between doses. For example, if you normally inject on a Monday and you want to permanently switch to a Friday, that's perfectly fine. You would take your Monday dose, then wait a minimum of 72 hours, which means you couldn't take your next dose before Thursday, before taking your new scheduled Friday dose. This ensures there's adequate time for the medication from the previous injection to start dissipating, preventing an accumulation of the drug in your system that could lead to more side effects.
Right, 72 hours minimum between doses if you switch days.
Furthermore, if you've somehow missed multiple weeks, maybe due to travel or an illness, you should definitely talk to your clinician about restarting at a lower step. Your body's tolerance to the medication can decrease if you've been off it for a prolonged period, so restarting at a lower dose and slowly retitrating back up is the safest and most comfortable approach to get back on track.
Good advice.
Yeah.
Okay, let's talk about the pen itself. This is how the medication is delivered, and it's actually quite user-friendly once you get the hang of it. These are single-dose pens, which means 1 pen equals 1 injection. They come pre-filled with the exact dose, so there's no measuring or mixing involved, making them incredibly straightforward to use and virtually eliminating any risk of dosing errors on your part.
This raises an important point about safety and disposal. Once you've used it, that pen goes straight into a sharps container. The design of these pens is incredibly clever. The needle is hidden both before and after the injection, which minimizes needle phobia for many and reduces the risk of accidental needle sticks. You absolutely cannot swap needles. There's no reuse of any part of the pen, and definitely no leftovers of medication in the pen after a dose has been delivered. It's a clear one-and-done system designed for both simplicity and paramount safety, ensuring you get the correct dose without unnecessary handling of sharps.
And a big shout out here, this is paramount. While we're giving you a general overview, this information is intended as a refresher for patients who have already been trained by a healthcare professional on how to use their specific device. Always, always, always follow the device's instructions for use. They're super important. Every brand of pen and even different versions of the same pen might have slight variations in their operation. So even if you're familiar with other injection pens, you need to read and adhere to the specific instructions provided for your Tirzepatide pen. Those detailed instructions are there to ensure you administer the full dose correctly and, most importantly, safely.
For the injection itself, the process is designed to be as simple as possible. First, always check the label to confirm it's the right medication and dose, and then visually inspect the solution. It should look clear and colorless, free of any particles.
Check the pen, check the dose. Got it.
Next, you pick an injection site. Your belly, your thigh, or the back of your upper arm. These areas have sufficient subcutaneous fat for proper absorption. Before injecting, clean the chosen area thoroughly with an alcohol swab and allow it to air dry completely to prevent infection. Only uncap the pen just before you're ready to use it. Don't uncap it and then get distracted.
Right. Ready, aim, fire.
Sort of. Then press the pen firmly against your skin and hold it there until the yellow indicator stops moving and you hear a couple of clicks. Those clicks are your auditory cues that the dose is being fully delivered and has completed. Once it's finished, lift the pen straight off your skin and then, as we said, immediately into your sharps container for safe disposal. It's a quick 2-click process designed for simplicity.
And don't forget, site rotation. This is a simple but really effective habit to develop. Why is it so important? Well, for a couple of reasons. First, it significantly cuts down on irritation or discomfort at the injection site. And second, and perhaps more importantly, it helps keep the medication's absorption steady and predictable. If you inject in the exact same spot every single week, over time, you can potentially develop something called lipohypertrophy, these small fatty lumps under the skin. Not only can these be uncomfortable or unsightly, but they can also actually affect how consistently and predictably the medicine is absorbed into your body, potentially impacting its effectiveness.
Exactly. It's really about consistency and avoiding tissue fatigue. A simple pattern is all you need.
Yeah.
Maybe inject into your belly 1 week, then your thigh the next, and then the back of your upper arm the week after, alternating between the left and right sides for each area. Your phone can be a fantastic tool to help you track this. You can use a simple notes app, set up a recurring calendar reminder with a specific site, or even utilize a dedicated health tracking app to log where you injected last. This ensures you're giving each site adequate time to recover before the next injection, and it helps maintain the medication's absorption as predictable as possible, contributing to more consistent results on your health journey.
So you've got these precious pens, but how do you store them correctly before you're ready to use them? You definitely can't just toss them in a junk drawer or leave them exposed. Proper storage is absolutely crucial for maintaining the medication's effectiveness and safety over time. What are the key rules to remember?
Before you use them for the first time, these pens need to live in the fridge. We're talking typically between 36 and 46 degrees Fahrenheit, which is the standard temperature range for most refrigerators. This is the optimal temperature to maintain the stability and potency of the medication's active ingredients.
Okay, fridge first.
It's also crucial to keep them in their original carton.
Yeah.
Why? To protect them from light, as prolonged light exposure can degrade the active compounds over time. And this is a major one. Never, ever freeze them. Freezing can irrecoverably damage the pun mechanism itself and, more critically, can alter the delicate protein structure of the medication. Once frozen, the medication can become ineffective or even potentially harmful. So if a pen accidentally freezes, it must be discarded immediately, even if it thaws.
Never freeze. Got it. Very important. Here's where it gets really interesting and convenient, especially for travel or just having your next dose ready without needing a fridge. A Tirzepatide pen can actually be kept at room temperature that's up to about 86 degrees Fahrenheit, or about 30 degrees Celsius for up to 21 days before you use it. This is super helpful if you're planning a vacation and don't want to worry about a cooler and ice packs, or if you just prefer to keep your next dose conveniently accessible on your counter for a few weeks leading up to your injection day. However, and this is the crucial catch, once it's been at room temperature, you absolutely cannot put it back in the fridge. It's a one-way street with that temperature change. So if you take it out of the fridge and decide to keep it at room temperature, you must use it within those 21 days or discard it after that period, even if it hasn't been used.
Right. 21 days at room temp, and use it or lose it. Can't go back cold. If we connect this to the bigger picture of medication stability, heat and direct sunlight are truly the enemy here. Think about avoiding leaving your pen in a hot car, even for a short period, or placing it on a sunny windowsill, for example. Temperatures consistently above 86 degrees Fahrenheit or prolonged exposure to direct sunlight can rapidly degrade the medication, rendering it less effective or potentially unsafe.
For travel, especially if you need to keep it cool without refrigeration, use a cool pouch, but be very mindful to avoid direct contact with ice packs. A cool pouch helps maintain a stable, cooler temperature, but placing the pen directly on freezing ice packs can risk inadvertently freezing the medication if the ice is too cold or the contact is too prolonged. It's about maintaining that sweet spot of cool, but definitely not frozen, to ensure the integrity of the medication.
Good tips for travel. Okay, let's be real. No medication comes without potential side effects. It's simply part of the deal. So what's in our comfort kit, so to speak, for managing the common ones that people often experience, especially when starting or increasing their dose? Knowing what to expect and, more importantly, how to manage it can make a huge difference in staying on track with your treatment.
The most common side effects are largely gastrointestinal, which makes sense given how the medication works to slow stomach emptying. You'll hear about nausea, some general belly discomfort, burping, either diarrhea or constipation, feeling full really fast, and a general sense of fatigue. Nausea in particular is often the first thing people notice, especially during the initial weeks of treatment or whenever a dose is increased.
Yeah, nausea seems common.
That feeling of fullness happening rapidly is actually part of the therapeutic effect for weight management. But if it leads to uncomfortable bloating or makes it difficult to eat enough, it can also be experienced as a side effect. And fatigue can be a noticeable symptom for some as their body adjusts.
So what does this all mean for you in terms of practical strategies? You can often manage these common side effects quite effectively by making some simple adjustments to your eating habits. Think of it like a gentler, more mindful approach to food. Instead of 3 large meals, try eating smaller meals more frequently throughout the day, maybe 5 or 6 smaller portions. Eating slower, truly savoring each bite, allows your stomach more time to signal fullness to your brain before you overeat. Make protein your first bite at every meal. It's incredibly satiating and helps preserve muscle mass. And go easy on greasy, heavy, or very sugary foods, especially when you're starting out or increasing your dose. These types of foods take longer to digest anyway, and they can often worsen nausea and discomfort when your stomach is already working a bit slower.
Building on that, sipping water throughout the day is super important, not just for general health, but specifically to help manage these side effects. Staying well hydrated helps with overall well-being and can sometimes ease gastrointestinal discomfort, especially nausea.
Hydration, got it.
A gentle walk after meals can also be incredibly helpful. Even a short 10-15-minute stroll can stimulate digestion and alleviate feelings of fullness or bloating. For constipation specifically, really focus on increasing your fluid intake and incorporating more fiber-rich foods into your diet. That means plenty of water and loading up on fruits, vegetables, and whole grains. And always, always ask your clinician or pharmacist before trying any over-the-counter remedies for these symptoms. While some OTC options might seem helpful, they could potentially interact with your medication or mask a more serious underlying issue, so it's always best to get professional advice first.
This is a big one. We've talked about managing common, mild side effects, but it's absolutely vital to know when a symptom goes beyond that mild discomfort and could signal a more serious issue that requires immediate medical attention. When do you absolutely need to pick up the phone and call your doctor right away, or even seek emergency care?
You could call promptly for severe belly pain, especially if it's located in your upper abdomen or on your right side, or if the pain radiates to your back. This can be a red flag for serious conditions like pancreatitis or gallbladder problems, both of which require immediate medical evaluation and intervention.
Severe pain is a definite call.
Also, be very vigilant if you're repeatedly vomiting or show any signs of dehydration. Persistent vomiting can rapidly lead to dehydration, which can be dangerous, affecting your electrolyte balance and overall bodily function. Signs of dehydration include extreme thirst, a very dry mouth, infrequent urination, or feeling lightheaded or dizzy when standing up.
Other critical red flags include any vision changes, especially if you have a pre-existing diabetic eye disease. If you live with diabetic retinopathy, for instance, significant or rapid shifts in blood sugar control can sometimes temporarily affect your vision. It's crucial to report any new or worsening vision issues to your doctor immediately so they can investigate. And of course, any signs of a serious allergic reaction, think widespread hives, swelling of your face, lips, tongue, or throat, or trouble breathing. While rare, severe allergic reactions or anaphylaxis are medical emergencies and require immediate professional help. If you experience these, call emergency services right away.
What's particularly important to note here is if you also use insulin or a sulfonylurea medication for your diabetes. If you do, you need to be especially watchful for symptoms of low blood sugar, also known as hypoglycemia. Tirzepatide,
when combined with medications that directly lower blood sugar, can increase the risk of these episodes. Symptoms can include dizziness, excessive sweating, confusion, irritability, a rapid heartbeat, or feeling sudden hunger pangs.
Watch for lows if on insulin or sulfonylurias.
If you experience these, you need to treat the low blood sugar immediately, for example, with glucose tablets or a small amount of fruit juice. And then contact your clinician so they can evaluate whether your insulin or sulfonylurea dose needs to be lowered to prevent future episodes. It's critical that you don't attempt to self-adjust these doses. That decision must always come from your healthcare provider to ensure your safety and effective management.
Don't self-adjust other diabetes meds. Check with the doc. A few more super important cautions to keep in mind, just so we're crystal clear on the non-negotiables for your safety and the medication's effectiveness. These are hard lines.
As we've stressed, it's definitively not for type 1 diabetes or DKA. And this is vital. You absolutely, under no circumstances, combine it with another GLP-1 medicine like semaglutide or liraglutide or another Tirzepatide brand. Using it with another GLP-1 agonist would be redundant and would significantly increase your risk of severe side effects without offering any added therapeutic benefit. And as discussed earlier, using Mounjaro and Zepbound concurrently while both contain Tirzepatide is also incorrect and potentially harmful, as their approval pathways and specific uses are distinct. These rules are in place purely for your safety and to ensure the medication works as intended within its studied parameters.
No doubling up on GLP-1s or Tirzepatide brands. Clear. Because Tirzepatide slows stomach emptying, as we explored earlier, this can actually affect how some other oral medicines are absorbed into your system. Real talk, this is a particularly big one for oral contraceptives. If you're relying on birth control pills, you may need backup contraceptive methods for 4 weeks after you start the medication and for 4 weeks after each and every dose increase. This is because the slower transit time through your digestive system can mean that oral medications, including birth control pills, might not be absorbed as effectively, potentially reducing their efficacy and leading to unintended consequences. Always confirm the specific guidance with your clinician or pharmacist, as they can help you navigate this interaction and ensure continuous protection.
That's a really crucial point about oral contraceptives. Definitely needs discussion. Furthermore, and this is critically important if you're undergoing any medical procedures, it is vital to tell any surgery or endoscopy teams that you are on this medication. The reason: slower stomach emptying can raise significant concerns about aspiration during anesthesia or deep sedation. If your stomach still contains food or liquid when you're under anesthesia, there's a risk that it could be regurgitated and then inhaled into your lungs. This can lead to very serious complications, like aspiration pneumonia. Because Tirzepatide slows gastric emptying, this risk can be higher than usual. So anesthesiologists and surgical teams need to be fully aware so they can take appropriate precautions, which might include adjusting the timing of your last meal before surgery or modifying the anesthesia plan to ensure your safety.
Huge heads up for surgery teams. Tell them you're on this. And lastly, on the caution front, but certainly not least, if you're planning a pregnancy, that usually means stopping this medication well in advance. We touched on this earlier, but it truly bears repeating because of its importance. The recommendation is often to discontinue the medication months before you even start trying to conceive to ensure it's completely cleared from your system. If, however, you find yourself pregnant while you're on it, you must notify your clinician right away. They need to be aware immediately so they can monitor you and the pregnancy closely and discuss the best course of action going forward.
Yeah, pregnancy planning is a definite stop well in advance situation.
Beyond the medicine itself, which is a powerful tool, what kind of lifestyle choices really work with Tirzepatide to maximize its benefits and support your overall health goals? This isn't a magic bullet that makes everything else irrelevant. It's the supportive partner. And like any good partnership, it works best when you're both pulling in the same direction.
Absolutely. Building your plate with a consistent rhythm of protein, plenty of non-starchy vegetables, whole grains or beans, and healthy fats is a fantastic approach. Protein especially is incredibly crucial because as you lose weight, you want to ensure you're losing fat mass, not valuable muscle mass.
Protein first, keep the muscle.
Focusing on nutrient-dense, balanced foods helps ensure your body gets all the vitamins, minerals, and macronutrients it needs while still allowing the medication to effectively help with satiety and portion control. And consistent hydration throughout the day is absolutely key. Water helps with digestion, nutrient absorption, and can also directly help manage some of those initial side effects we discussed, like constipation or fatigue.
And building on that, go easy on heavy or high-fat meals, especially when you're just starting out or increasing your dose. Your stomach is already working a bit slower thanks to the medication, and those types of rich, fatty foods can sit there even longer, significantly increasing the likelihood of nausea, indigestion, or general discomfort. Think lighter, simpler meals, particularly as your body adjusts. It's not about saying goodbye to your favorite comfort foods forever, but perhaps enjoying them in smaller portions or less frequently, especially early in your treatment.
A critical lifestyle component that often gets overlooked, particularly when the focus is on weight loss, is incorporating regular physical activity. Aim for 2 to 3 short strength sessions weekly. This is profoundly important to help protect your muscle mass. While weight loss is a key goal for many, you want to ensure you're primarily losing fat, not valuable muscle. Strength training, even short sessions using your own body weight, resistance bands, or light weights, signals to your body to retain muscle as you shed pounds.
Strength training, so important.
And lastly, if you choose to drink alcohol, moderation is absolutely the name of the game. Exercise extra caution if you're also on insulin or a sulfonylurea, as alcohol can significantly affect blood sugar levels, and combining it with medications that lower blood sugar can increase the risk of hypoglycemia. So be mindful of your intake and always discuss it with your clinician.
You might have heard people talking about microdosing Tirzepatide. It's a term that gets thrown around quite a bit on social media and online forums, often with a lot of buzz and unfortunately a fair bit of misinformation. What exactly is that about, and what should our listeners know?
What people generally mean by microdosing in this context is taking smaller doses of Tirzepatide more frequently than the prescribed weekly schedule. For example, instead of a 5 milligram dose once a week, someone might attempt to divide that dose and take, say, 1.25 milligrams 4 times a week. The theory behind it, often driven by patient experience, is usually to try to spread out the medication's effects or to minimize side effects, which can sometimes be more pronounced after a full weekly dose.
Okay, so smaller doses more often than weekly.
However, if we connect this to the bigger picture, it's really not advised at all. This practice is entirely off-label, meaning it's not how the medication has been approved to be used by regulatory bodies. The drug's pharmacokinetics, which is how it's absorbed, distributed, metabolized, and eliminated by the body, are specifically designed and studied for weekly dosing, not for more frequent, smaller doses. The research and approvals are based on that weekly schedule.
And here's where it gets really interesting and, frankly, quite risky. It's not proven to be any more effective or any safer than the standard weekly dosing. In fact, it carries significant risks, including dose errors and serious issues with product quality if you're obtaining it from unverified sources. When you try to manually break down a weekly dose into smaller, more frequent injections, especially from a single-use pen, you dramatically increase the chance of measuring incorrectly or even contaminating the medication. Furthermore, if you're obtaining unapproved compounded versions, which are often what's being microdosed, you have absolutely no guarantee of what you're getting. You don't know if it's truly the right active ingredient, if it's sterile, or if it's even the correct strength. You're essentially playing Russian roulette with your health, risking ineffective treatment, or, far worse, severe and unpredictable side effects.
Exactly. Huge risks with dose errors and unknown product quality. The safer, clinically supported alternative is always to work closely with your clinician for a slower weekly step-up, combined with all those great comfort strategies we talked about for managing side effects. If you're experiencing uncomfortable side effects with your current weekly dose, your doctor has several proven strategies. They might decide to keep you on that dose for a longer period of time before increasing it, or even temporarily step you down to a lower weekly dose to allow your body more time to adjust. This approach still gives your body the chance to adapt within the approved dosing schedule, mitigating side effects safely and effectively, rather than resorting to unproven and potentially very risky microdosing practices that lack scientific backing and regulatory oversight.
So stick to the approved weekly dosing, work with your doctor on titration and side effects. Much safer. Okay, let's talk access. With all the buzz and demand for these medications, it's understandable that people are looking for ways to get them. But real talk, where do you get this medication safely and authentically? Because unfortunately, with high demand, often comes a lot of less than reputable sources out there.
This is a point that cannot be stressed enough. You should only obtain and use Tirzepatide from licensed U.S. pharmacies. Period. Avoid social media sellers like the plague. Licensed pharmacies are strictly regulated by state and federal authorities, ensuring that the medications they dispense are genuine, have been stored correctly to maintain their integrity, and are dispensed safely with proper counseling from a licensed pharmacist. Social media, on the other hand, is a completely unregulated environment for drug sales, and it's a dangerously high-risk environment for counterfeit or substandard products.
Only licensed U.S. pharmacies. Got it. Why is this distinction so important?
Because counterfeits or unapproved compounded versions can have the wrong ingredient entirely, or even the wrong dose. This raises an absolutely critical question about your safety and the medication's efficacy. Imagine taking something you believe is Tirzepatide, only to discover it's actually something completely different or has none of the active ingredient, or even worse, far too much. At best, it's ineffective, meaning your condition remains untreated, which can have long-term consequences. At worst, it could be incredibly dangerous, leading to severe and unpredictable side effects or delaying proper, effective treatment for your health condition. You really are risking your health when you step outside of licensed pharmacies and the regulated healthcare system.
Really serious risks with fakes or bad compounds.
And if cost is a barrier, which we know it absolutely can be for many individuals, as these medications can be expensive, please talk to your clinician or pharmacist. Do not resort to unverified sources. Your healthcare team is your strongest ally here. They can often guide you through prior authorization processes with your insurance, and they can also inform you about patient assistance programs that might be available directly from pharmaceutical companies. Many drug manufacturers have programs designed to help eligible patients afford their medications. Your healthcare team is truly your best resource for navigating these financial hurdles safely and ethically, ensuring you get the authentic, effective medication you need. We as a show do not sell medicines or link to sellers. Our singular role here is to inform you about the medication and how to access it through legitimate, safe channels.
Good point. Talk to your team about cost concerns. Okay, so we've taken a truly deep dive today into Tirzepatide, the powerful active ingredient that forms the backbone of Mounjaro, used for type 2 diabetes blood sugar control, and Zepbound, indicated for chronic weight management. We've explored how this dual GIP-GLP-1 medicine works its wonders in the body, the ins and outs of starting doses and titration, what to do if you happen to miss a dose, and how to safely use and store the injection pen. We also covered the common side effects you might experience and, crucially, when to pick up the phone and call your doctor, plus a comprehensive look at important cautions like interactions with other medicines and the absolute necessity of avoiding unverified sources.
What's truly fascinating here is how understanding these intricate details about your medication empowers you. It transforms you from a passive recipient into a more informed, active, and confident partner in your own healthcare journey. Knowing the why behind the what allows you to ask better, more targeted questions during your clinician visits, enabling you to feel more confident and in control about your treatment plan. It shifts the experience from merely taking a medication to actively managing and understanding your health.
Well said. Empowerment through understanding. If this deep dive helped you gain clarity and confidence, please do us a favor and tap that like button. And for more clear, no-jargon explainers on important health topics like this one, make sure you subscribe to Pharmacist Online. Do you know someone who's just starting Mounjaro or Zepbound, or perhaps considering it? Share this deep dive with them. It could genuinely help them feel more prepared and informed on their journey. Remember, this deep dive was for educational purposes only, not medical advice. It's for adults, and your own clinician knows your health best. Always consult them for personalized guidance tailored to your specific situation.